So
Sure.
very good. Well, apologize for the rough start, everybody. Thank you so much for the time, and I think we're ready to roll now. So we'll simply get going. As JP indicated, I'm happy to be part of this today. My name is Dan Whitney. I'm the president and CEO of Medova Healthcare. Medova is a healthcare management and group benefits TPA located in Wichita, Kansas. We offer major medical, MEC, dental, vision, and ancillary benefits. Have been doing it for a number of years. Are currently in, this slide says 31, I think since then we've added 3 states, so we're about 34, 35 states. We've had the good fortune of growing by about 34% per year over the last 4 years, and currently have about 40 to 50,000 participating members as of 16. This gives you an overview in terms of the states that we are in. We have licensing pending right now in Virginia. We have just added. California should be good for us by the end of the first quarter, if not sooner. And so those are the 2 states that we have simply added. And then the light green states are ones that obviously we're filling in as well. Iowa, as an example, is in process, as in Idaho. So we are literally trying to get a nationwide footprint to make sure we can continue to grow and support employers and group health strategies across the country. What programs are available for us? We have several programs that obviously have an integrated focus. The group health program is our leading program. Our leading product is a product called Lifestyle Health Plans. It is what's called a level funded plan design. So some of them call it fully funded, alternative funded. They're different names for it, acronyms. But the unique thing about the program is it has an integrated wellness built in, a number of other value-added benefits that really focus on education, healthcare consumerism, making sure that obviously we can provide some really unique benefits in a value-added way to the member, while also being on the cost containment side for the sponsoring employer. We recently added dental vision. We have worksite and obviously supplemental plans as well. JP does a lot of that work for us and with us, so obviously we partner with him for a lot of those things. And then of course we offer then as a value add at no additional cost COBRA administration for all of our lifestyle health plan designs. We have the 125 cafeteria plans, wellness programs, everything else on the admin side. I don't need to tell anybody that I believe that healthcare continues to rank as one of the top 5 concerns for business owners. It's something that obviously outside of payroll is one of the most prohibitive cost items on the budgets these days. ACA has continued to impact all of us from an employer size. And one of the unique things that many people may not be aware of, which is really the mantra of what we were focused on from our product, and that is that 75% of all of the healthcare costs for the commercial age population, i.e. those covered under employer group health plans, are related to chronic lifestyle conditions. I always say in my presentations, we found the problem and it's us. The decisions that we make every day, or that our employees are making every day in terms of the way they lead their lifestyles, the decisions they make, whether they're a good or bad consumer or not, the things that they do as far as healthy or active or sedentary, obviously the diet and everything else goes into obviously that. But when 75% of the U.S. healthcare costs are controllable, that would make a big impact obviously in terms of the sustainability and the cost for the underlying premium if we get those under control. So because of that, that's really been what we have focused on, and making sure that we can take a multifaceted approach to population health, the cost management, and those kind of things for our members and our client employers in that process. We do that through a solution that we call Lifestyle Health Plans. We named it on that way on purpose, and that was because we want to make sure that we can truly have a positive impact in people's lifestyles and in their health behaviors. Our product is really focused on the employer market of 5 to 500 employees. We get above 500 employees and the product is still available from a benefit standpoint, but we then move, or at least encourage the look at more of a truly self-funded ASO model, as opposed to the level funded model where we take the risk away from the employer. But obviously we can do both sides, but we believe obviously that there's a lot of value added benefits, and we have a lot of track record in terms of being able to provide a lot of good benefit cost savings and retention costs. Okay, so what makes us different? We believe there's 3 or 4 things that obviously that we're able to help our partner employers on immediately. Number one, our core belief is founded in that it's not a one and done. We didn't get in the situation in a year. We're not going to get out of it totally in a year. So a little longer term approach to making sure that there can be controlling of healthcare costs through individual health improvement and the focus. We are successful on a fairly frequent basis to provide immediate savings. The average savings for a group is somewhere between 5 to 15% compared to their current benefit structures they have in place and their premiums. Everything we do is on an incentive-based model, so that it benefits from the employee standpoint. So there's a number of incentives built in. So not only do obviously they get a good benefit program, but there's some incentives they get for being focused on their lifestyle, for being a good healthcare steward, those kind of things in the process. One of the unique things that we do is provide, after the first year on the program, we look at a multi-year strategy. We've done a number of things like offering 2-year rate guarantees, 24-month rate guarantees after year 1, caps on annual increases, those kind of things, because we believe that this is a partnership and that it needs to be a multi-year type of strategy. And then the whole delivery model is very key to make sure that we can keep healthcare as local as possible. We make sure that everybody's aware of the processes, of the value adds, of everything that we do, which is a little different than the normal fully insured carrier, where you're basically buying premium and then hoping you have a good year after a year. Run through some real quick case summaries for you, some in the industry and some outside. This is a service industry, the 15 plan year, which obviously we just renewed them. In this case, 145 life group. Annual premium from prior carrier was $1.5 million. First year savings for them was $244,000, or a 16% savings. This is a community mental health center, 400 employees. In this case, the employer received a 47% increase from United Healthcare before they came to us. We were able to simply put a $480,000 annual savings involved for them. They're currently in their 3rd year, and we've been able to keep them in single digits renewal every year since the inception. Another community mental health center, a client of ours, so this one 300 employees. First year savings was literally $500,000. We just gave them a renewal rate increase for 17 of 8%, so we're still, even now, we believe below where we started with them on in terms of now going on to the 3rd year of the program, and obviously have done a good job, we believe, of helping manage their costs. So it's something that obviously we're very proud of. Okay, and then a manufacturing group here. This one has to be about 115 size. In this case, this is a group out of Tulsa, Oklahoma. We've had tremendous wellness participation year after year after year. They've averaged 71% in wellness per year. Their renewal increase in 16 was 10 to 14% historically. Our renewal increase was 0. So if you look at the industry average for health insurance, which is running that 10 to 14%, in this case, they are now going on their 3rd year in a row with a 0 increase in their plan. So obviously they are very happy with what we've done for them. Okay, a brief word about level funded in case people have not heard of that term before. A level funded program is basically a program that is designed to be on a self-funded reinsurance chassis. So legally it's considered a self-funded plan. That in itself has a number of advantages tax-wise and regulatory-wise. But it's designed to simply remove any risk from the sponsoring employer beyond paying 12 months of paid premium. So it acts almost exactly like a fully insured plan in that you have a premium rate, you pay that for each enrolled employee. When you do that 12 times over the course of a, monthly for the course of a year, you've been deemed to fully fund the product, and then there are no additional claims costs to be paid, including run-out claims. So we build in a specific stop loss as well as an aggregate. Specific is for any one claim to protect you from any sort of individual catastrophic claim, on an individual member, and then the aggregate protection provides you for the smaller claims in terms of, but for the entire group. So if you have a specific stop loss, as an example, of $50,000, and you have $1 million of claim, the claims fund is only at risk for the first $50,000. The carrier takes the risk. And then the aggregate stop loss says if that claims fund exceeds X, which obviously is a quoted premium amount, that the carrier takes on anything above and beyond that. So we provide inherently in the way the product is designed, we're removing any risk from the sponsoring employer. 3 buckets involved in that. Obviously the claims that come in, the claims fund to take care of that, and then the insurance piece to make sure that obviously is where we come in to make sure that we facilitate the insurance coverage side of it so that you're well covered and that there is no risk to the employer. Gets back to what we talked about in terms of how you're protected against any one claim. So there's a limit in terms of liability. So once a claim on an individual member hits a certain level, which is called your specific stop loss level, then everything above that level is paid for by the stop loss insurance carrier. And then, JP, the next slide is if you have a bunch of smaller claims, then obviously those are added up totally in terms of the overall aggregation of all those small claims to a total maximum out of pocket or a maximum claims fund amount that obviously is where the aggregate kicks in. So there's 2 levels of protection with every group. We right size that based on the size of the group. But the bottom line is the quoted premium rate that you are offered in a proposal process is the maximum that any sponsored employer will pay on a monthly basis for the product. So the summary in terms of how it benefits the group, number 1, for those of that have been self-funded before, you can have $100,000 of claims one month and $500,000 the next month and $50,000 the next and $200,000 the next. There's a real yo-yo in terms of not having any sort of level financial predictability about it. And so this basically levels it out so we can make sure that we simply move it into a very stable environment of predictability in terms of knowing what your insurance costs, your coverage costs are going to be month after month after month in terms of a fully inclusive product that includes both the insurance protection, claims, admin, everything. So it's very, very predictable. There is a claims fund that's put together. Obviously that claims fund, once it's there, any positive variance from that claims fund is available for return to the member. In most cases, if there's a positive variance, we will use some of that obviously to give you a great renewal. We found that rather than having ebb and flow of premium, most employers are more interested in sustaining their healthcare costs, and so that's one of the things we really try to do. But we contribute 1/12 of that claims fund every month. Over 12 months, obviously that accumulates to the annual, and there's reporting back to you to kind of show you how the experience is going in terms of claims funding and the claims fund dollar amount versus the actual claims that have been paid. Okay, monthly payment comes in one single check. We basically send it to 3 different places. It goes for the premium to make sure we have the actual insurance protection. It goes to make sure that the admin costs are covered, to make sure we have network access, all the vendors are paid for the integrated programs that we have in place, and then the remaining portion of it goes into the claims fund that is obviously pre-funded on a monthly basis to be there to cover claims as they come in. Okay, level funding is obviously picking up a lot of steam in the marketplace. Historically, there's only a few carriers that were doing that, but I think now almost every single carrier is moving into some degree of level funding. And that's really because it provides the benefits of both worlds. Even though it's considered legally a ERISA-based plan or a self-funded plan, so it falls under the Department of Labor and ERISA laws, it's really designed to simply make sure that there can be some benefits of lowering the overall costs and expenses. There's lower admin costs, there's some less mandated benefits, premium tax is reduced, a number of things like that. Obviously, as compared to a fully insured alternative, there's a lot more flexibility and cost containment ability in terms of a level funded product itself, but with the same protection involved of a fully insured product. So it really gives you a nice blending of all of that. All of our plans are designed to meet ACA requirements as we know them today, not only from a minimum essential coverage standpoint, We have 5 mech plans, the minimum essential coverage. We also have all of our plans except for one meet the requirement of minimum value. And so we have the ability to simply combine that. We have a number of employer groups that offer both MEC coverage as well as MVP coverage. One of the unique things that we have from a participation standpoint is we combine both the MEC and the MVP products to meet participation requirements. So we're doing a lot of work in that regard. A good example, the Pizza Franchise Association is a client of ours, and in that hospitality space, they use the MEC MVP combination a lot in that product. We do a lot of multi-plan scenarios where we'll have a base plan and then buy-up plans. If you want to simply have a standard defined contribution approach to simply give $300 a month for benefits, that will buy them a nice single policy at a higher deductible level, and then obviously they can buy up from there in terms of that process. So we do a lot of that from a benefits design and an offering standpoint for groups. Okay, insurance platform comparison. What we've basically done here is simply giving you the columns in terms of fully insured, traditional self-funding, and then our lifestyle level funded product. You can see in terms of all of the different dots and looking at the features of each, that there are some individual features of fully insured and self-funding, but from our experience and the way the product is designed, we've combined those in terms of the level funded product that is obviously called lifestyle. Okay, program components. All of our plans come with the ability to offer 16 different plan designs that each employer can choose from. You're able to offer up to 4 plans side by side. So that's where I was saying you can have the base plan plus the buy-up plans if you want. All plans, regardless of the 16, have the integrated wellness program built in. No additional cost for that. All of the integrated wellness programs have a deductible credit incentive. They have a unique matching program, and they all come with our bonus bucks or cash rewards for individual members based on their participation with the various wellness incentives and lifestyle improvement incentives that we have in place. A number of value-added benefits we have, for example, 100% lab benefit, 100% diabetic supply benefit, teledoc or telemed programs built in at no cost with no copay. All of our plans are secured by A-rated insurance carriers in each marketplace, so we only work with top-rated carriers for the coverage. So all of that combines to provide a very unique and stable offering for you, for your employees. Cost containment. One of the things that we do different and we believe better than most, and that is that because we understand healthcare so well, and that is because in a prior life I actually ran the physician division for a fairly large Catholic healthcare system, and so we understand healthcare from the provider standpoint and have moved several of those strategies over to the employer side. But a number of cost containment strategies that are really getting at some of the low-hanging fruit that a lot of people don't know about. Good example, outpatient imaging and surgery. Many of you may know that an MRI done in a freestanding imaging center will cost about $800. That same MRI done in an outpatient hospital setting will be somewhere between $3,000 to $5,000, and the irony is that in most cases it's the same radiology group that's doing the read. Surgery is even more extravagant. We're seeing about a $7,000 to $8,000 variance in surgery based on the site of service, freestanding ASC versus hospital. And so you can appreciate how, if you have a number of those done on a yearly basis within your employee ranks, how that can quickly add up to some immediate cost savings. We do that because we have a care concierge service, so that all imaging and surgery has to be pre-certed. The minute it's called in at the provider or the member level, we work with them to make sure that we can identify the most cost-effective facility that is available for them to use. They always have the opt-out provision. If they simply have to go to the hospital, they have to go to a certain provider. As long as it's in the network, they certainly can. There may be additional co-pays related to that based on, once again, making sure we have some cost containment measures built in, but it certainly is up to them in that regard. But we're having a great deal of success in moving care to a more cost-contained environment with maintaining the quality levels of the care. So that's doing a lot of good things in terms of saving dollars. ER utilization. Once again, many people know ER is the most expensive place to go into to simply get routine care. Average ER bill runs anywhere between $4,000 to $8,000 depending on what you have done. So it's a great place to go if you have a life or limb-threatening event. Otherwise, it's a horrible place to receive care for just normal routine care. So we build in things such as urgent care strategies. We have obviously our 24/7 telemedicine service, primary care copays, all those kind of things to really help in that process. We implemented for 1/1/17 a very unique drug program to really incentivize the enhanced use of generic drugs. About 95% of all meds are available on a generic basis, and so we have now built in 2 tiers of generic utilization. We have a $1 copay and a $15 copay for generics, wanting to make sure that we can truly incentivize the more routine, chronic condition-related pharmaceutical needs in a generic basis. And so, you know, the Walmart $4 list, as we call it, is all available in our plan under $1. Anybody that jumps onto a chronic condition management program and has drug needs in that regard is automatically qualified for the $1 program for that copay. So there's a number of things we do there to make sure that we can make it very cost effective for the member, and by doing that, obviously get a handle on the chronic condition management, which obviously saves costs in the long run for everybody. Implant cost management. Many of you may not be aware, but there's a tremendous amount of markup in implants. You know, we've seen implants such as total knees or total hips, where the actual implant cost is $5,000 to $7,000, and the hospital is charging $70 for that, you know, for that service. So one of the things we do from a concierge service standpoint as well is try to identify those and make sure that we can build in some cost containment features to make sure that we can cap those costs. We allow the hospital to make 165% of their cost on it, so they're still making a good markup, but it eliminates the 500% to 800% markup that we're seeing in many cases across the country, you know, for those implants. Specialty meds and injectables. Specialty meds are the fastest growing cost item in healthcare today. With all the new meds that are being introduced, obviously we see advertising on the TV every day in terms of that, and there's a reason for that because people are using them more and making the pharmacies a lot of money, the pharmaceuticals a lot of money in the process. So we have a standard list of exclusions for that. We can build in the price of anything, but we will find in a lot of cases that if we exclude certain medications, that the member is eligible through our Care Concierge service to get access to that through manufacturer assistance programs or other things that don't cost the employer or the claims fund anything, but still provide the medicine or the specialty medicine or injection at a level that's at or below what they could get through the plan. So the member is not harmed. We save money for the employer, and by doing that, obviously, it allows us to contain healthcare costs and manage renewals better from a cost containment standpoint. Some value-added benefits we have built in. Our Healthy Rewards program is basically a cash incentive program to encourage and reward compliance with our chronic condition and our wellness programs. So each member has the ability to voluntarily sign on in a chronic condition management program. After they achieve certain thresholds in that, there actually is some cash rewards that they receive for that to recognize them for their, for their making good strides in managing their conditions. I've mentioned our Lifestyle MD program. That's our telemedicine program. We work with concierge medicine practices to do that. They're available 24/7, 365, gain direct access to a boarded primary care physician who can diagnose over the phone, do things such as minor script refills. They Skype. They do a lot of different things like that to make sure that they can provide real-time guidance and save time, effort, and cost in terms of not having to go to the ER, to an urgent care center, to spend half a day in a provider's office, etc. in that process. So a lot of good success stories, with our Lifestyle MD program. Then we have 2 ancillary products available. We have our Just Diabetic Supplies, which basically provides anybody that has diabetic testing needs with a 0 copay, 100% benefit for their diabetic supplies. So based on the testing needs that their physician will prescribe for them, we set up a program to auto ship every 90 days their testing strips, their supplies, their Lancets. We provide a free meter for them to make sure they can stay in control of their diabetic management process. Direct Health is our lab program. We have a national reference lab relationship with LabCorp across the country. We have regional lab relationships as well. And we're able to basically buy lab on a wholesale basis and pass on the savings to the member and the group. and in doing so offer it at a zero copay, 100% benefit to each of the members and the plan itself. So we avoid the huge markups that most practices or most providers have on lab. It still gives the results back to the physician from a care management standpoint, but it eliminates some of the middleman and some of the markup in lab, which has provided some tremendous savings to our members and obviously to our groups. 70% of all medical decision making requires some lab, and so it's a really nice thing to simply have that available. We're very proud of our wellness program. We call it our Health Rewards program. It's an incentive-based wellness program designed to simply provide members the ability to lower their out-of-pocket expense. And the way it works is through a deductible credit matching program with as high as $1,000 per year per adult benefit to them to lower their deductible by $1,000 just for being in the program and achieving some successes. In addition to that, we have our Bonus Bucks program, which is our cash reward program that I mentioned for those things in addition to above and beyond simply just the wellness program for chronic condition management and some things like that. We have just launched a new wellness center, and so we're proud of the upgrade we have on that. We have an integrated online health risk assessment and lab testing opportunities. We've been getting rave reviews about the interface of it. It allows to have some personalized programming that tracks you as an individual, relates to you as an individual member, and it really is your resource point to make sure you can track your points and track your progress and those kind of things, all through the online portal. We have a dedicated staff of health coaches and wellness coordinators. We do not outsource any of that. Those are all folks that are located here internally and provide good old Midwestern customer service and values in terms of taking care of our members. And we receive high accolades for that interaction, and are very proud of the wellness program we have in place. So how does the wellness program work? It works in the following manner, and that is that upon the initial plan year, the initial effective date, and let's say that it was for a March 1 of 17 effective date. Each member that enrolled in the plan, each adult member, would have the ability during the first 60 days of the program to jump on our wellness portal and do two things. First of all, complete our online health risk assessment, which takes about 15 or 20 minutes total. And in exchange for that, they immediately receive a $250 credit to their deductible. So if their deductible was $1,000, it's now $750. They also have, at the end of that, have the ability to simply print off a lab requisition form and take it to a draw station to their physician office and have our biometric lab work done. And the minute that we get those results back from that lab work, there's another $250 deductible credit given to them, or $500 total. The results, the credit is not based on results of the lab testing, so it's not a results-based program. It is clearly just for doing the work and establishing the baseline. You have the ability to simply get the credit. What we have found in so many cases is that individuals may not be aware of a chronic condition that they have or that they are at risk for. And it's very difficult to manage risk if you don't understand that you have the propensity for a chronic condition. And so there's been a number of test cases where we've received affirmations that somebody has actually completed a lab and found out that they were pre-diabetic, that they had high cholesterol, that they had some things like that that they could control, or identified something on the proactive front end, which obviously is a wonderful scenario for us and the member as well. So a combination of those two, the HRA and the lab testing, gives them their $500 per adult. So if you have an employee spouse, it's $500 per member to reduce their deductible for that year. That's in year one. You then have the ability to then, over the course of a year, to then do a number of different activities, and it's customized based on each individual's member's desire, to then earn what we call our healthy reward points. And if you earn 2,000 points over the course of each plan year, you have qualified for the upcoming plan year for your deductible credit. So you see 2,000 points gives you your maximum $500 credit for the new plan year. I mean, it's not a cliff system. You have the ability to earn anywhere between $100 to $500 credit under your deductible. And the unique thing that we've done that we're not aware of any other plan in the country doing, and that is we have a matching program in place. So in year one, going into year two, If you earn your $500 credit for year 2 because you've earned your 2,000 points, you have earned your $500 of deductible credit for year 2, and then Lifestyle Health as a plan matches you 25 cents on the dollar. So you would start year 2 with a $625 credit to whatever deductible you choose. So if you chose a $1,000 deductible for your renewal, your deductible would now be $375 instead of the $1,000. In year 3, we move it up to a 50% match. In year 4, 75% match. In year 5, whatever the member earns on their own for their deductible credit, we will match that at 100%. So that would be up to a $500 credit to their deductible on top of what they've earned themselves, which would be $1,000 per adult would be a maximum. So with that in place, that helps us manage costs, because now if you know you have a $1,000 credit available, you may not want to purchase a $1,000 deductible plan as your base plan. You may want to purchase a $2,000 deductible plan, and with a $1,000 credit, it gets you back down to a net of $1,000. And in doing so, it provides you with a more cost-effective premium as well. So we've had a lot of good success in sustaining costs through that. Not only are we getting healthier people, and they're spending less money, but obviously we're able to do that through a benefit cost as well. Our bonus bucks program are for additional cash incentives for members that participate in proactive consumerism things, disease management programs, chronic condition management, where there's actual cash rewards for achieving certain benchmarks in terms of their participation in those things. Those are all done on a voluntary basis. They are all opt-in. A member has to simply say, yes, I want to do this. There's no arm twisting or whatever else in that process, but we found that we have a lot of good compliance and a lot of good interaction in that process with our wellness team and our health coaches and coordinators that do that. Our concierge telemed program is called Lifestyle MD, 24/7 year-round access, board-certified primary care docs available for any situation. Our plan is offered at a zero copay, so there's never any cost for a member to call and talk to one of our Lifestyle MD individuals at any point in time throughout the year. 24/7, zero copay all the time. We encourage utilization of this because obviously it's a very proactive way to manage your health, and certainly can be a time and life-saving event for a member as well if they have an immediate need that they need to talk to somebody about. Our lab program is Direct Health. We mentioned that already. LabCorps are our reference lab. We're basically able to offer 100% lab benefits. We do that because of our provider background. We're purchasing the lab for the same price that the physician offices do or the hospitals do. The difference is we eliminate the markup. And whereas a physician office may buy a lab test for $3 and mark it up to $40, we pass on the cost to the plan directly at the $3, so that obviously there's savings to the member, tremendous savings for the sponsoring employer, and in doing so, obviously the lab results are available to the physician at no cost to the member involved. Great successes in that. Diabetic supplies, what I explained about that, obviously auto shipped every 90 days based on your ordering and frequency of needs. And so we want to work with each member that has any diabetic needs to make sure that we can provide that to them as a value add so they can stay in charge of managing their condition. Plan overviews. We mentioned before we have 16 different plan designs. We have 4 plan options in each of 4 categories: Healthy Choice, Healthy 100, Healthy Value, and Healthy Consumer. They are fairly self-explanatory in terms of the categories themselves. And so all of them have the wellness program built in. They all have the value-add benefits built in. So really the variance is going to be in the level of deductible and the coinsurance applied to each plan within the plan designs themselves. Here's an overview of that. Our Healthy Choice plans are going to be our 80/20 PPO plans. They're going to have lower out-of-pocket expenses and lower deductibles, starting at a $1,000 deductible in those, with 80/20 coinsurance, office visit, ER, and urgent care copays built in, RX copays built in, obviously all the 100% benefits we have in that regard. Our Healthy 100 plans are going to be a little higher deductible plans, but once you hit your deductible, they're 100% coinsurance at that point in time. Our Healthy Value plans are going to be our more premium-sensitive or cost-saving plans. And then our consumer plans are going to be those that qualify for an HSA or HRA program should an individual want to simply have a health savings account tied to their plan they're all qualified HDHP type of plans. We mentioned our X program already. Yes.
Hey, Dan, not to interrupt, but one thing to mention on groups over 100, we have our 16 standard plans, but you do have the ability to customize benefits if that's something that the group would like to do.
Very good point, JP. Absolutely. Yeah. When you get a proposal from us, you're going to see all 16 of our standard plan designs, not only in the outlines of the plans, but also the proposal for pricing of each of those plans on a side-by-side basis. For groups over 100, should you want to customize a little bit, we certainly are welcome to that customization and can then either revise a proposal for you and send out based on those customized benefits or look at any tweaking that you want done in that process. So we welcome the ability to do that. Okay, our X program, as we mentioned, we have two-tier, we have a 5-tier program, $1 and $15 level for our generic copays, $50 preferred brand, $80 non-preferred, and then a 50-50 cost sharing for specialty, which is becoming more common in the marketplace. We mentioned we have a number of minimum essential coverage plans. These right now are probably more a compliance play than anything else, although we have enhanced a number of the plans to offer things that are above and beyond, just the normal MEC type of benefits. Some of them obviously have hospital benefits and outpatient benefits as well. Very cost-effective plans for those that simply just need to have something to simply meet ACA compliance. They can be offered alongside major medical plans. They're designed for groups with 50 or above because that's where ACA compliance is right now. They all include the Lifestyle MD program. They all include the discount programs and access to the PPO discounts for things that are not covered under the plan. We still pass on the discount for those services. Kind of a summary of that, and of course, obviously, anybody interested in it, we can give them more detail or simply get you a proposal for these. There's no underwriting required for these MEC plans. They're all guaranteed issue with no medical underwriting at all involved in any of them. As you can see, the benefits vary from everything, just the basic ACA required benefits on the Healthy Essentials piece, all the way over to where we do have a number of primary care and specialty visits, outpatient, ER, inpatient, and some drug benefits for our top 2 plans. Range in price from $50 to around $200 single rate based on obviously the benefits built in. So gives you some price sensitivity there for for a compliant plan that's more cost effective. We've recently added a lifestyle dental and lifestyle vision programs because obviously dental and vision have tremendous benefit and impact in terms of health as well. And so for our dental product, we use the Aetna Dental Administrators Network, which we've had great success at. And the vision program we use a network called VSP, which is probably the largest and most recognized vision network in the country. So all of those can be integrated in. They can be offered on a standalone basis if you want. We do consolidated billing for all of these so that if you take all 3, obviously we can simply have it all come on a single bill for you, which is nice from an administration standpoint. And the dental and vision are priced very aggressively because we believe it's a very important piece to have, certainly coupled with the lifestyle medical program provides you a nice turnkey lifestyle benefits program match. Two different dental options right now. We have a $1,000 and a $1,500 annual benefit. One of the unique things that we've done is built in the orthodontia coverage into the rates. So in either of the plan designs, we have that ortho coverage built in. As long as you can prove you've had a year of prior dental coverage, that ortho is available from day 1. Standard plan designs, 180 50 type of plan designs as well. As I said, we use the Aetna Dental Administrators dental PPO network for that. Vision, we have a $120 and $150 annual benefit program, very standard in terms of the benefits, $10 copay for the exam, $25 copay for frames. Frames are available every 24 months. Lenses are available every 12 months. Contacts, obviously, in lieu of lenses are available. And so VSP is our network. in that regard. And so once again, you can choose which of those makes the most sense. But we're getting a lot of good penetration and a lot of interest in these plans because of the value of the benefits and obviously the price competitiveness of the rates. Underwriting, JP will be happy to take you through this, but there's, to get an initial rate, obviously we just need a few simple things. We need a company profile, we need a census, a copy of current plan design and rates, to then move those into a final or firm rate quoting process. We would either need to simply then move it into the underwriting process and either simply have health applications for groups under 100 or claims history for those groups that are over 100 for at least 2 years of claims history. And with that, we can simply provide a firm rate proposal for you. JP, I don't know if you want to add anything to that or not.
No, it's pretty standard stuff in terms of what's needed. Generally, Dan, what are you all running, about 7 days to get a firm rate back if it's not in fourth quarter crazy time?
Yeah, somewhere between 5 to 7 days is our typical turnaround time for, once the information's all in, to simply get a firm rate back.
Okay.
Okay, we blew that through pretty fast with as much we had to cover, knowing obviously that we are sensitive to everybody's time. But Frank, JP, will certainly be happy to open it back up for any questions or back to you for next steps.
A couple of things I would like to add is by being members of MHCA with the arrangement that we have with them, there is an association discount to the rates. So a couple of those groups that you saw in our real case studies, the savings has been pretty significant with that association discount. And obviously the renewals have come in pretty favorable as well. One question we get quite a bit is, does everyone stand on their own claims, or are you blended together as part of the association? So if I could reach out to any of you who are interested, we could explain better how it works. But we actually have a rate matrix designed for MHCA members where you would fall into one of 20 different tiers. So everyone does stand on their own experience. You're rated within the matrix for the savings, but you're not pulled together from a claims standpoint. In other words, if you have a good year, your claims are not, or your rates are not going to go up dramatically as a result of everyone else having a bad year. Does that make sense?
Yeah, JP, the other thing that I failed to mention is that we talked about level funded versus truly traditionally self-funded. One of the things that we do that makes us unique as well is that the platform of Lifestyle Health is available. If you want to start on a level funded basis, you can move back and forth between what level risk you want to take all the way to truly traditional self-funding with the benefits remaining the same, but you taking on more risk, or going the opposite way and simply having a truly level funded where you take on no risk whatsoever, or a combination where you take on, in more of a health reimbursement type of scenario, the first X number of dollars of risk, and then the carrier takes it back from there. So we have the ability of moving back and forth on that risk plateau on an individual employer basis, on an annual basis, year to year, based on what makes the most sense for each individual employer.
Okay, Dan and JP, so far I don't show anybody that's got any questions. Nobody's raised their hands. The only question I have is, will we be able to make these the slides available to members? I've had a couple people ask about that.
Without question.
Yeah. I'll email it to you, Frank, and then I'll also include our contact information. You can see our phone number listed there, but I'll include my email address. Feel free to reach out to me if you'd like to set up individual meetings or calls to go through the details of the plan again and discuss getting quotes. You'll have everything we need to do that as well.
Okay. Thank you.